is I'm working in a alternate room because I just moved and I have this little tiny desk and I hate it. So I'm wiggling around because I'm not comfortable. I mean, it's literally just the size of my computer and my mouse pad. So hopefully I can navigate through this and get us through this without pulling out my hair. I'm going to turn my camera off first. As Nikki said, we are going to be video recording this so we can post it for future reference. So let me turn off my camera and we're going to get rolling, and I will turn my camera back on at certain times throughout the training. All right, so we sent the slide deck out yesterday afternoon, almost at 5 o'clock, because we were kind of still trying to get it hot off the presses with the most up-to-date information. And I'm always a stickler for looking at something and making sure it's exactly like I want it. So hopefully you were able to get that and print it. If you like to have it printed, you can take notes on it as we are going through here.
I don't know why it was. Yeah.
You got it.
Shoot, hear me?
Please mute your microphones and remain muted throughout the training. Zane Stetler, please mute your microphone. Thank you. All right, so we're going to go ahead and begin with our training. I will say that the slide deck contains 33 slides. I do not feel like we will have time to cover all 33 slides in the slide deck. Some of the information is a review, and it takes you straight to SharePoint with some new SOPs and stuff like that. But we're going to do some actual live demos, and we're going to look at the monitoring and investigation logs for the next fiscal year, which begins on July 1. Now, as we all know, DSS and ACLS has many different roles out there as we are regulating adult care homes and family care homes, and we have other hats that we wear. I know our DSS partners do different things, guardianship, SA, other types of things, APS, but key point here is we are all doing very meaningful work that protects the residents that we serve. And so this training session is actually provided to you as an ad hoc training. And what we're going to kind of look at is the oversight that ACLS is required to obtain or maintain over DSS based on the law. And again, we will cover the changes that are coming up on July 1 with the logs. Now, the training audience here are going to be our DSS staff, such as adult home specialists, and their managers, and anyone that's really going to be entering or reviewing documentation on the quarterly monitoring and investigation logs will probably benefit from this training. So if you have a colleague that's not on here and they are reviewing or entering information on these logs, you may want to just kind of share with them that they may want to kind of pull it up at a later date, especially if they're having questions with these new logs. All right, so just as a review, some of the key areas that ACLS is overseeing in our partnership based on the law are, of course, monitoring complaint investigations, the staff training that is mandated by law for our DSS, adult home specialists, and supervisors, as well as identifying noncompliance and citing that noncompliance based on the interpretation of the law and at the appropriate levels with supporting documentation and factual evidence to support that level of noncompliance cited. Again, one of the things that we are also important that we kind of oversee is this documentation piece. And it's kind of in the middle here because we have documentation related to all of these other things that we oversee. And it's very important that that documentation be kind of submitted to ACLS timely, because we will use that documentation as we are regulating adult care homes ourselves. So that's kind of where that partnership comes in. We're going to be pulling your documentation as we go out and prepare for surveys, if we get complaints in, when we are doing follow-ups, that type thing. We are also maintaining specific data that is required by law, and we have to have this documentation. Of course, our star rating team uses some of this documentation to ensure that star ratings are issued pursuant to law. So it's very important that the documentation piece kind of be brought to your attention. That's what's here in the center of the slide. So again, this slide just reviews some of the most prominent areas that we are overseeing of DSS. Here are the actual statutes and SOPs related to our oversight. I want to draw your attention to this last one, this action plan protocol. That one is actually not in effect yet. That is still under review. What we are going to actually do is we're going to send that out to some of our DSS partners and kind of get some work groups in on that. Was talking with our chief this week. So this is the only one that you will not see posted now, but you will see information coming along through emails about it. Again, these statutes up here have not changed. These are mandated by law. And of course, that 2.11 is related to monitoring. 11B and C is related to monitoring. 131D-26 is related to investigations, and then the 211 is, 212 is related to the training requirements. And then as far as the SOPs, standards of operation, we have our County Department of Social Services reporting requirements, our County Department of Social Service complaint investigation guidelines, as well as our County Department of Social Services investigation of a resident death guidelines. And I want you to know that the top three here, 1, 2, and 3, those have all changed effective July 1st. So if you have old copies of those saved on your desktop, you want to make sure that you are deleting those and you are pulling the newest policies from SharePoint, and they have been posted to SharePoint yesterday afternoon late. All right, so basically the oversight criteria, we're talking about how we are overseeing DSS. When we are talking about overseeing monitoring, we are looking to see that monitoring is completed pursuant to the law, as well as the ACLS standards of operation. We're looking at complaint and death investigations to ensure that they are completed pursuant to the law and our ACLS standards of operation, as well as ensuring that documentation related to the regulation of adult care homes is submitted by our DSS partners to ACLS pursuant to the laws and, of course, our ACLS standards of operation. And then our training team also oversees the DSS staff training requirements to ensure that the minimum training requirements are met, as well as met within the timelines established by law. And then as far as the non-compliance being identified and cited, of course, that is, we oversee that as a regulatory agency for both our ACLS surveys, complaint investigations, as well as DSS. So let's just kind of look at some of the key changes we're going to see to these logs beginning July 1st. And the key reason for these changes is to make these logs more user-friendly. They were very confusing. We had extraneous information on there that was really not needed. So we've kind of streamlined these. We have updated our directions so that they are more thorough. We feel like they're more easy to follow. I did a training recently and I was doing some research and I saw a quote somewhere that said, make it impossible to misunderstand. And so I kind of took that in my mind and I've ingrained it. So when I was doing that training, and then as I do this training, and I wrote the directions for the monitoring and investigation logs, I had that in mind. And I kind of shared that with the folks who were helping me with this project. And so we hope that you will find these very thorough as you are looking at those. Of course, these changes also were based on feedback from our DSS partners, feedback from our ACLS regional team supervisors, our branch managers, and also audits that were conducted by ACLS. I'm sure I probably talked to, I would say, a minimum of 40 folks by phone, and then many of you was in correspondence with by email, and that was a larger number related to these audits of the complaint investigation logs. So we kind of looked at areas of opportunity, how we can make this easier. And so with that being said, just make sure you have archived your old logs beginning July 1. So before we go any further, please take note that we are in Q4 of this fiscal year, and you will continue to use the logs you have been using up until now until you turn in your Q4 logs for this fiscal year. You will begin using the new logs when you are logging investigations that have an exit date of July 1, 2024 or greater. And we're going to look at that as we go through our logs. So again, we have brand new monitoring logs and instructions. We are going to be documenting our visits based on the exit date. And the reason we did that is because we are able to now eliminate the pending and not yet determined outcomes because they will not be relevant, and we will be able to capture the data in which the order in which the investigation or the monitoring or the visit was actually completed. Now, I do want to bring your attention to the number of logs that will be used by county. This is an important change, and please keep in mind that when we looked at this, we are looking at this from a big picture, and it will impact some counties, but in the past, there was the option to maintain one combined investigation log and one combined monitoring log for the whole fiscal year for all of your DSS staff. So for instance, I'm going to call out Robeson County. They used to have 3 adult home specialists, but their supervisor is Stacy. They had 3 adult home specialists, Julie, Katrina, and the one that left. So, and I can't think of her name right now, but they logged all of their complaint investigations and monitoring visits on one log. They had 3 adult home specialists. They logged them on one log for each quarter. Okay, then we have Guilford County, or let me think, let's do a different one. Let's say New Hanover County. So we had New Hanover County, and we had Regina and Gwen, and they logged their investigation and monitoring visits on separate logs. So they had 2 adult home specialists, and each one of them used a separate log. Going forward, that second option, which is option B, will only be applicable when your county has 3 or more primary adult home specialists on staff. And the reason we did that is because we get so many logs and we have to review these, and it's very difficult to capture the data accurately. So if you have 1 or 2 adult home specialists that are your primary adult home specialists out there conducting monitoring investigation logs, you should be using 1 investigation log and 1 monitoring log going forward. All right, now we're going to kind of review these logs in detail. So let me come over here. And we're gonna actually review both the monitoring and the investigation log, and they're both going to take quite a bit of time. So I'm going to let the folks on the call here decide which one we look at first. So if you will just submit your answer there, would you prefer to look at the monitoring log or the investigation log first? And if you will vote, we will choose which one gets the most votes. And see what we got. Ooh, it's overwhelming. Look at that. Monitoring log. Well, maybe more. Let's see. All right, so it looks like we're looking at the monitoring log first. And I will tell you that's probably good because that is the one that I find most difficult. And so we were going to pull that log up and we're going to look at that. So let's see what we can do here. Find my log. All right, so here is the new monitoring log, which will be effective July 1, 2024. So right off the bat, I want to draw to your attention how you're going to know you have the new log. First of all, the old logs are going to be archived. Second, when you pull up the new log, it's going to be color coded just like you see it. So if you open a log and it doesn't have colors on it, then you know you have the wrong log. Number two, it's going to tell you at the top what fiscal year we're in and what quarter number. You can see here that it is color coded. We have purple for quarter one. Quarter two, we have green. Quarter three, we have blue. And quarter four, we have orange. Now, some of you, this may be helpful. Some of you, it may not be helpful, but we are trying to help you determine which tab you're on and which tab your visits go on. So that's why we have kind of color coded it and labeled it. What you will also see is for this monitoring log is we have the quarter number, we have the monitoring rule areas, we have the monitoring time period, and we also have the rule areas, the generalized rule areas. I want to draw your attention to this bottom bar here. I hope everyone can see this. My cursor is on this bottom bar, and if you move this bar to the right, it moves the sheet over. Okay, so each one of these tabs has the same sheet. So quarter 1, 2, 3, and 4 have the same sheet. And as you are moving to the right, sliding this bar over, it is moving you along that sheet. And we have this log kind of frozen where as you move across to the right, you're still going to be able to see the facility name and license number as you are completing your lines. And the way you're going to know that you have completed all columns for a line is you're going to see this bright green, and it's going to be kind of your stopping point. This means if I get to this lime green column and I have filled in the applicable information in the columns for my line, then I don't have to key in anything else for that line. So we're going to start out here with an overview of kind of how we've changed it. At the top here, this is going to be the same information. So I'm going to just go over this as I'm a new adult home specialist and I am training my cohort, Bree Jameson, and we are filling in this information on the log. So the top one, you would enter your county name. So our county name is Any. Bree and I are the only two primary adult home specialists. So we are using the same log. Our names are entered here, and we enter our supervisor or our supervisor's names. Sometimes an adult home specialist may have one supervisor and another adult home specialist may have another supervisor. That is the case. You can enter two names there. So our supervisor is Ms. Jennifer Fender. We have one supervisor. This is our monitoring log for quarter one. And this is where we are going to monitor our visits for July, August, and September that are related to. And if we're not sure how we're going to find out is we're going to come over here to this visit. And so if you're ever not sure where a visit goes, it's going to be in the instructions. But if you're doing a monitoring, a car follow-up, assisting with a state survey, providing technical assistance, or delivering correspondence, you're going to enter that visit on the monitoring log. So let's just kind of look at this demo and then we're going to do one together. So Margot's Family Care Home, that is no change from the previous log. You're going to enter the facility name. The license number, that is no change. You will enter the license number as it appears on the license with hyphens and numbers, no spaces, please. The facility census. So this is going to be your facility census at your first on-site visit for this line. So that means the day you go on site to do whatever you're putting here, the first day goes here. Now, this has been clarified from the previous log. On the previous log, it just said facility census. So we got a lot of questions. Is it the facility census on the first day I'm there? Is it the facility census on the day I exit? Is it the facility census on the day I deliver? So if you are logging a visit, you want to put the day you walk in on site, that is the census that goes here. The next column here for the monitoring log is where you will document all on-site visit dates. On the previous log, you had to log only one date per line, and then you would have to come over here and choose for your outcome undetermined. That is not relevant anymore, so you will enter each day that you are visiting for this visit. Each date that you're on site goes here. It can be a range of dates. It can be multiple dates. It can be one date. It can be two dates. It can be 10 dates. But you want to enter those dates here, and you want to use a 6-digit date format. That is in the instructions, and the reason we ask for 6-digit date format is because that is the format that we use in our cars when we are using our principles of documentation, and we want to make sure that we're using that 6-digit date as we are reviewing and reading these. If everyone is on the same page, it will help, and it will also help you as an adult home specialist if you start entering in different ways of dates or typing them out. You're going to run into problems with the data and formulas that have been integrated. So here we were on site from 8/4 to 8/5. The lead adult home specialist initials go here. That was Bree. She did this monitoring visit, and you can put more than one adult home specialist initials there. That does not change. So the type of visit, this is now going to be a drop-down box. If you remember in the past, the monitoring log went all the way across and you had to check little boxes, and you could check more than one box for the reason for that visit. Going forward, only one reason can go per line. Only one rule can go per line. Okay, so she is out there monitoring. She's in a family care home, and she's monitoring the rule area 0300, which is the building, which is the established focus monitoring area. So we are going to enter our rule number, which is going to be a change on your monitoring log from your previous log. So now when you enter the rule number, you will only enter one rule number per line, just as you have on your complaint investigation log, but now that will be applicable to your monitoring log. You're going to enter the general rule number for your monitoring visits because you are looking at the generalized rule areas. If you are conducting a follow-up visit, you will have to enter the full rule number. So if you were conducting a follow-up visit in healthcare referral and follow-up and you were in adult care home, it would be 0902B. And then we will actually choose the outcome for each rule area. So if you have more than one focused generalized rule area for the quarter, like when we get over here to Q2, you're going to have to put 0400 on one line, 0500 on one line, and 1309 on one line, because only one rule number goes per line. So if you're monitoring during Q1, though, you only have one generalized rule area, which is 0300. So this is a change when you are entering your rule numbers. What many of you run into is you are entering your periods and your dots, and you're typing in 10A, NCAC, 13F, and that's not needed. Okay, you don't need to do that. It wastes your time. You don't have time to do all that. So what we've done is we've set this up, and all you need to do is enter the F or G for the rule set. So of course, if it is a family care home, it will be rule set G. If it is an adult care home, it will be rule set F. So we are monitoring a family care home. So we have G0300. Please note that we don't have any periods, any decimal points, any names, anything like that. It's just the rule numbers. Okay, so we have completed our monitoring. We're going to come over here and we're going to choose the outcome. When you're choosing the outcome here, please know that the outcome choices are going to be based on your type of visit. We're going to see that as we demonstrate this. So we did not have any deficiency here in this rural area, generalized rural area, when we monitored Margot's family care home. The next line is brand new. On the previous car, it had you entered, I think it had a where you could enter the actual general statute number. So here, you're going to actually choose every time you get to I here, you're going to choose yes or no. So, and it clearly says, was resident right cited in the car? We didn't cite a car, so our answer is no. And when we choose no, we're not going to have any other choices here because that's how we've set up the spreadsheet. Okay, so you're not going to have any other choices. Okay, so if you were to choose yes, then you will have your choices. You will choose what was cited, and we'll go over that shortly. Just wanted to show you that. So you are answering this line here, was residents' rights cited in the car? If it was cited in the SOD, you're going to hit no, because this question specifically says, was resident rights cited in a car? And if you cited it in a car, you will choose yes. If you did not cite it in the car at DSS level, you will always choose no. All right, then you're going to come over here. And again, I'm moving my bar along because I'm still filling in my line for that top visit. The date the documentation was delivered to the facility. So whenever you are having that facility sign that monitoring report, or that, I can't remember the number, I think it's 4606, I'm not sure. The day that you're having them kind of, you're saying, hey, we've completed this monitoring, we don't have any deficiencies. That's the date that is going there. The date that you are sending any documentation to ACLS will go here. And in this particular case, if we didn't have a deficiency, there's not going to be anything sent into ACLS. So that would be NA, because you did not cite anything. You're not sending your monitoring report into us. You're retaining that with your sensitive notes, so you will not have anything there. And then if you want to add any rural areas, you could, or any other notes you could, but it's not needed. So let's go now to the best AL. We're going to type in, there's our license number. There's our census on the day that we began this monitoring visit. So the first day I was in there, I'd come in, I'd put 9/11/24. And maybe I don't know, I'm going back. I'm going to put my initials and I'm going to choose my reason. And I'm going there to monitor. And I'm going into F0300 because this is an adult care home. And let's say I didn't get done. In the past, you would have to put pending. And then you'd have to come back down here and you'd have to put it on another line and put the new date. You don't have to do that now. If I have to go back on Monday, I'm going to come back in and I'm going to say 09/15/24. And then I'm going to get my final outcome. Let's say we had a standard deficiency here. So we've cited standard deficiency. Okay, we've cited it in the generalized rural area. Did we cite resident rights? No, we didn't. Maybe we did, but this time we did not. So I'm going to go to the next block. I'm not going to have any choices because we did not cite. Of course, we're not going to choose anything here because we didn't cite it. The date the documentation was delivered to the facility and the date it was delivered to ACLS. So let's say you went out and you had a car, you completed your monitoring on 9/15 and you told the facility, hey, I'm going to be writing a car and I'm going to be bringing that back to you. So you're going to put in the date the last date that you delivered that correspondence. So instead of putting the date that you're delivering the monitoring report, and if you want to put both, you can, but easiest way for you to do it is to put the date you delivered that car. So if it took you 4 days to get the car written and you took that car back to them on 9/19, that's the date that goes there. And then you're going to have to send a copy of it to the ACLS email group because we have to have a copy of that car. So let's say you send it to the original email group on 9/20/24. It's going to be the date that you submitted it to the email group. And then over here, since you cited a standard deficiency in that generalized rule area, you're going to have to enter the actual rule area that you cited it in. So let's say we cited it in 0316A. So you're going to, I've got my caps on, sorry about that. So you cited a standard deficiency. There's your rule number. That lets us know you monitored in that rule number, but you actually cited, this is what you cited. Okay, and that's where the standard deficiency was cited. Let's say you went out there to do monitoring and you had found noncompliance in 0301A, 0316A. You're going to choose the highest level. Let's say you cited 0301A at an A2 and the other one at a standard. You're going to come over here and you're going to say A2. Did you cite resident rights in the car? No, I didn't. I'm going to come over here. I'm going to use my same dates and I'm going to put 0316 standard deficiency, comma 031301 F0301A A2. So that shows the levels and the actual rule numbers that were cited. Now I want to bring your attention to this purple column. So we're telling you to key in a 6-digit date, right? But when you key this date in, it doesn't matter how I key it in. This spreadsheet is set up. It's going to change it to a different format. Don't worry about it, okay? In this column, that's the way that it is programmed. In these columns, it's going to stay, and on your complaint column, it's going to stay 6-digit. But if you key it in as 6-digit and it changes to another format, you're good. That's kind of how we had to set up the spreadsheet. It's very persnickety. And it took a lot of work to kind of get it done, even when we're choosing our choices here. Like when we had to choose assist with state survey, we had to add these underscores here. Even though it doesn't look pretty, that's what we had to do to kind of get this sheet to tell it what to do. So just know that there are some caveats to spreadsheets, and that's kind of why you're seeing it like it is. So again, if you are citing monitoring and you are citing one rule, then of course you're choosing the level of the one rule you cited. If you're citing more than one rule related to that monitoring, then you're choosing the highest level, and then you are coming over here and you are placing the actual entire rule number cited as well as your level in that actual notes column. Now I'm in the green. I know I'm done. So I'm going to the next one. All right. So I want to show the, let me show my investigation log first. Okay, so here's our, let me show our investigation log. I want to show you this log here real quick. All right. If we see this complaint investigation log here, the next line on our monitoring log is related to an actual car that we cited here. So we cited a car based on a complaint, and we had it cited here, but then we're going to go back and we're going to complete our follow-up. Okay, so what you're going to see over here is you're going to see the follow-up to that logged on the monitoring log. So make sure we're back on the monitoring log, and we're not. So hold on. And this is kind of difficult to navigate. So right here at the best AL, we were looking at F902B. We substantiated it at a standard deficiency. There was our date that we completed. We exited with the facility and we sent the stuff in. So we're going to go back and follow up on that pursuant to law. And when we do the follow-up, it goes on the monitoring log. So let's look at that monitoring log. And the next thing we're going to see on our monitoring log is the follow-up visit to that 902B standard deficiency. So there we go. We are on the best AL, and there's my license number. I've entered that. There's my census on the first day I got on site. I entered my dates, all dates that I was on site, and the reason for my visit is car follow-up right there. Then, because it was a full rule number, I cited 0902B. I need to put 0902B here in this column. So I'm going to hear F0902B. You don't have to enter any of the, again, we're not entering any decimal points, any parentheses, that type thing. And we're going to choose the outcome over here. It was abated. That means we didn't have any noncompliance. Let's say that it wasn't abated and you came back and you cited it as a B, then you would choose whatever level you cited it as, okay? If it was still a standard deficiency and you recited it as a standard, you would choose standard. But in this case, it was actually abated. And then you're going to come to this line and it's going to ask you if you cited resident rights in the car. The answer is no. And hint, hint, hint here, the only time you're going to be citing resident rights in the car is if you are investigating that rule and that's what you cite in the car. You're not going, remember, we don't use the refer to statements in our cars anymore for resident rights like we used to in the past. Okay, so there's going to be no choices here. We're not going to use that. We're going to key in our dates. And so in this particular case, sorry about that. We are delivering that monitoring report to the facility, telling them, hey, you are in compliance now on this date. Then you are delivering any documentation related to that to ACLS, whatever date you send it in. And you can put general comments here. They're not mandatory, but I just put follow up to a standard deficiency with a car exit date of 7:30. My rule number is already over here. This kind of helps track. So, and again, this is optional because this was a follow-up. Now, if you were citing in the car, you would want to enter the rule number and the level. Okay. And that's just for monitoring. All right. So now we're going back and we're going to Star Care. And we have monitored Star Care. Bree did in F0300. She cited a standard deficiency. We don't know what it was in yet, but it was in this generalized rule area. She did not cite resident rights. There's when she delivered it. And so she needs to enter the rule number that she cited. So you don't have to put standard deficiency there because it was the only rule cited. If you want to, you can, but it's the only rule cited. So that's all you need to do. Now, want to bring your attention. She was out there monitoring in F0300, but she ended up citing something else in that car. And you see that these dates are here. So she goes out and she's monitoring in the physical plant. And while she's there, the residents are complaining that they're not having any activities. And so, you know, based on our policy and based on our monitoring and investigation protocols, if we have concerns brought to our attention, we are to investigate those, gather additional evidence to determine if noncompliance is there or if the facility is in substantial compliance. So Bree pulled the additional evidence she needed through observations, interviews, and record reviews, and she determined that this facility was not in compliance at 905D. And she cited it as a standard deficiency. It's in the same car. So she entered it as a new finding. Okay. And she put it directly under that visit because it was cited in that car. Okay. So she just, and you have to note that it has to go on a separate line. Okay. So she can't just come up here and add 0905. You only can have one rule or rule area in this column. In the past, again, you could put multiple rule areas, but only one rule per column, per line, excuse me. And if you have multiple rules there, your log is going to be returned to you and you're going to have to correct it, because if you don't put the rules separately, the data will not be captured. So right here is where it is capturing it. And if you put more than one rule per line, it's not going to capture that data. Okay. So she has cited F0905D at a standard deficiency. She's going to come here. She did not cite the resident's rights in the car. She answers these questions. She's moving along. Here's the information when she delivered it to the facility. She delivered it because it was in the same car with this one. And she sent the documentation to us. And there's her rule number. So she doesn't have to put standard deficiency there. Actually, hold on a minute. That's wrong. 905D, that should be there. I put it on 2 lines. So she's already got her rule number over here because she entered it as a new finding. So I want to clarify, sorry, y'all. So new finding, your actual rule number will go there. And so you will not need to enter it in this column. Okay. So if you had 2 new findings, let's say you cited 0905D as a new finding and 0901A as a new finding, they would have to go on separate lines. And you would have to choose an outcome for each one. Okay. All right, now we're going to Margot's family care home. She asked us to come out to talk to her about getting a license for a second family care home. So we're going to log that visit. We're going to put the information that we have here, and we're going to choose the reason for our visit, and that was technical assistance. We can enter a rule number here, or you can just enter text as to what your visit was for. So I just wrote in licensed facility. When you come over here for outcome, you're going to see that there are no options, because if you're doing technical assistance, you do not need to enter any information about level of severity. There is no level of severity here. Resident rights cited, no. Come all the way over. If you did not have anything to deliver to her, you would hit NA. And if you wanted to put additional notes here, perhaps you wanted to put your technical assistance notes here versus here, you can do that. All right, let's do another one. We're going to go to wrong. It's very hard to nap. There we go. And as you are navigating through this spreadsheet, if you were in, this is column A, column B, column C, here are your row numbers. So if you're entering data in column A, row 13, and you want to get to the next column, you can hit your tab box and it'll take you over, so you don't have to physically move your cursor. So if you're in this box and you hit tab, it's going to take you to the right. And that's your tab button, which is beside your Q button on your keyboard. You can alternatively, if you were in a specific row and tab, if you will look on your bottom of your keyboard to the right of your space bar, there are arrow up and down. If you move your down, it will move it up and down, and if you move the left, it will also move it left and right and move it up. So you can navigate it that way, or you can just pick up your mouse and move it to each block. Okay, I mean, and I know that sounds very elementary and very rudimentary, and I know we have very educated people on here, but I'm just trying to, anything that comes to my mind that I think might help you fill these out more efficiently, I'm trying to kind of bring that up as I think about it, because these logs can be very daunting. And so when this comes up and it's already on there, you can hit tab and it'll leave it there. So when we went back this time, the census was 5, and I'm going back on 10/01/24 TTW. Wait a minute, that's outside of September. That has to go on Q2, October, November, December. So I'm going to come back over here and I'm going to move all this stuff. This doesn't go in here. Does that make sense? Because if I don't have an exit date okay, and so if I'm going here and I'm doing a technical assistance and I did it on 10/1 and I completed it on 10/1, it's going on Q2. Now, as we looked here, all of these were done within July, August, and September. See that? So they're on Q1. Let's say I'm going back and I've started a car follow-up. And I went back on 9/21 and I went back on 9/26 and I'm running into all kinds of problems. And I'm like, well, I'm gonna have to go back again. So now I'm gonna have to go back on 10/2/24, not 23, 24. So what's going to end up happening is my exit date is going to be greater than September. So I'm going to have to move this to my Q2. Okay. So as you are planning your visits, if you're going out near the end of the month, if you're starting out at the end of September, I would advise you, you know, if you don't think you're going to get it done on that, if it's like a car with multiple rule areas or a complaint with multiple rule areas, and you know that it's going to take you more than one visit and it's going to exceed the timeline for that quarter, go ahead and put it on the quarter that it belongs. Okay. All right. So I want to see if we have any questions on that particular session there, that little demo there. And what we're going to do is we're going to kind of open it up to questions, and then we're going to move to Q2 and we're going to do a demonstration together with participants. So we don't want to spend all of our time. We're about 10:18 now. We've gotten to 11:30, so we want to make sure we have time to look at our investigation log. But let's take questions if we have any. You can type those in the chat.
There is a couple of questions. Tamara, first question.
Okay.
Is can you list new findings on investigation logs if it is found during an investigation?
Yes, you can, and we're going to go over that. Absolutely. So I'll address those complaint investigation log questions when we get to that. But you are absolutely correct. It's going to be the same way. It's going to be under type of visit, and you're going to choose new finding. Yes.
Okay, great. And there's only one additional question at this point, and that is, are you deleting it or duplicating it on the next quarter?
So that is also a great question. So you are going to physically delete it from this quarter and you're going to move it to the next quarter. You do not want to duplicate that data. Okay. Let me see something. Okay, so it allowed me to do that. Let me see if this is protected or not. Hold on a minute. Okay. When we get to our investigation log, let me protect this sheet real quick and see if I can give you a quick way to move those to other quarters. Let me see. Okay, so let's see. So the best way for you to do that, and this is going to be, and I'm glad that we're running into this now, so we can address this. So when you are going to move it to another log, you can bring your mouse or your cursor to that line, and you see that arrow there. You can right click and you can hit copy, and then you can take it to the quarter you want and the line that you want, and you can put your cursor over there and you can hit paste. Okay, it's not going to let you do it because it's on a protected sheet. Okay, I'm glad that we see that now. Okay, so basically you're not going to be able to do that, and we do have to lock these down. So you're going to have to re-enter it over here. Okay, and so once you re-enter it over here, it's going to end up leaving this line blank because it went to the next quarter. So let's figure out how we're going to do that, because we don't want to leave any blank lines. So if we went over to the next quarter, so if we exited over here, and I'm so glad we're doing this, which is why we are going to do a demo with some of our counties in a moment. So if we are moving it from one to the other, we need to get this information off here. So what's going to happen is if I come here and I hit delete, So I'm moving along and I'm hitting delete. What's going to happen is you're going to end up with a blank line. And when that happens, what I want you to do, unless you're told different, is type in move to new tab and just leave it like that. That lets us know that whatever was on this line was moved to a new tab. Let me see what it's going to do to our, and the reason we can do that is because just make sure if you use move to new tab, and I'm going to update our directions so it says that if you say move to new tab, make sure that you don't key anything else in because it will capture stuff as being cited when it wasn't. Okay, so if you type in move to new tab, don't type anything else in unless it's in the note column. Okay. So if you're now, let's say it's your bottom row and you're not going to end up with it, you can just delete it out. You know what I'm saying? But if you're in the middle of a spreadsheet, you don't want to have to go back and re-enter everything. So if it's at your bottom row, go ahead and just delete it off, you know, and re-key it in over here. But if it's in the middle of a spreadsheet and you've got 70 lines and you've got to have number 14 only moved, then don't rekey everything. You can either delete that line and move the stuff on the, so the options are this. Instead of moving to new tab here, you could come down here and you could take your very bottom line before you submitted it and move it to the blank line. But that is just crazy extra work. So if you are running into that, just type move to new line in your name column. I mean, new tab, move to new tab. And then don't key anything else in and it won't mess up the data. And it'll let us know that you had to delete that line and it's going to be on a new tab. Okay. And I will add that to the directions and we will make sure that that is very clear when we do our investigations too. Thank you for that question. I really appreciate that. So at this time, I would like to ask Mr. Matthew Thompson from Durham County. He is our Durham County supervisor. If he would please assist me. I did call him cold. I have a couple of DSS partners that I kind of called cold this morning and asked them to help me with a demo. So I wanted them to kind of come on here and give me, you know, a scenario so we can kind of log it and troubleshoot it. And so Matthew, if you are available, please unmute your mic and have at it. Try to stump the trainer and let's figure this out together.
Okay, I'm here.
Okay, thank you.
All right, so I guess we're doing a monitoring.
Yes, sir.
So we'll start with the facility name.
Okay.
So I visited the Shady Grove Family Care Home number 2.
All right.
And okay, yeah.
Okay.
And that license number is FCH 032 000.
Right. And what was your census when you got there?
They had 3.
Okay. All right. And what type of visit are we doing?
It was a let's say it was a focused monitoring. Can we say that?
Sure can. All
Okay.
right. And so the adult home specialist here, my new adult home specialist partner is now Matthew because Bree quit. Bree said, I can't do this anymore.
Right.
She said, I cannot do these spreadsheets anymore. So we hired Matthew Thompson. Our supervisor is still Jennifer Fender. And note that we're not using separate logs. We use the same log. We just changed the name and we're still in any county. All right. So Matthew's doing this one. All right, Matthew, what day are we on site?
I went July 15th.
All right. So July 15. So we're going to put it right over here. It's going back to this column. Did you exit in July or I mean, July, August or September? Yep.
Yes, I exited
Okay.
the same day.
Gotcha. Okay. So we're going to move it. That's exactly what we want to do. It would go over there. Let's finish it on this one just because. Okay. So we're just going to finish it on this one just because. So there's our date. All right. And what rural areas were you looking at? Hint, hint, hint. They're on here.
This particular one is 0318.
Okay. So you did 0318. Okay. 0318. Oh, okay, so I see what you're saying. You're doing quarterly monitoring for 300, so we are gonna put it on this one, okay? So we're gonna
Okay.
say G0300. Since we got a new adult home specialist, I've got to add Matthew up here.
And I guess I'm just realizing, with all the information, so there's a separate one for focus monitoring and then another one for just run-of-the-mill monitoring. Is that correct?
I'll show you. It's
Okay,
if you're
okay.
gonna, for monitoring, you're gonna choose the same thing. So let's see.
I got you.
FCL dash 999 dash 000. I don't remember what you said, Matthew, but we're making it up. So
That's fine. That's fine.
07 dash 1524. Okay. All right. And so we're doing monitoring. So your options, Matthew, are going to be monitoring. So whether you're doing a focused monitoring area that's mandated by the ACLS SOP, or you're doing extra monitoring in another rural area, you're going to choose monitoring. Okay.
Okay, okay.
And if
Gotcha.
you're choosing the focus monitoring pursuant to ACLS, you're going to choose these. But if you're using your own, then you'll key in what specific rural area you're looking at. Okay.
I got you. Okay.
All right. So we went out to do monitoring in the building. And did you find any issues?
Yes.
Okay, what we got?
I cited, so like I said, I cited 0318. That's specifically outside premises because they had a abandoned car in the backyard full of hornets nest and rats.
Oh my goodness. Oh
Yeah,
goodness.
it was
Okay.
bad.
It sounds like it was. Okay. And you said it was 318A?
I think that is A.
Okay, good. Okay.
I think
All
is that
right.
it? That's the first one.
Okay. And what else did you cite?
Yes, A.
Okay. And is that
Mhm.
it?
Yes.
Okay. And what level did you cite that at?
I'm going to cite it at a standard.
Okay. Standard deficiency. And did you cite resident rights in your car?
No.
Okay. Sounds good. And because we did not cite resident rights, we don't choose anything here. If we did cite it, we would choose the resident right number that was cited. We will not choose a level of severity because this is all related to resident rights and we did not cite resident rights, so we will leave that blank. Now we're going to put the date that you delivered that car to the facility. Matthew, what date did you take it over there to them?
I didn't have a whole lot on my plate, so I was able to have that delivered on July 18th.
Look at you. You're taking care of business. Woo woo.
Yeah, we
All
don't mess
right.
around.
Good for you. All right. Now, when did you get that turned into ACLS?
I emailed that on the same day, July 18th.
Right. He's taking care of his business. So there we go. So and then I'm moving over here and he cited G0318 and he's at green and that's all he's got to enter. So there you go. That's it. Shady Grove
right.
done. Boom. Moving on. Okay.
All right.
All right. So I'm going to do one for me. Matthew's out this time. So I might have to do Shady Grove number 2 for him this quarter for quarter 2. I've got to because he's on vacation and I'm having to look after his stuff. So I've got to go to Shady Grove and I've got to look at, for family care homes, I know I've got to look at staff qualifications, which is 0400, and staff training and competency, which is 0500. So I've got 2 rural areas. So I've got to enter them both on a separate line. So I'm going to G0400 and I'm going to G0500. All right, I'm gonna say Shady Grove. And when I went this time, they had 2. All right, and I'm going on, let's say I'm going on, we're in October, we're gonna go on 10, 12, let's go on 10/26. That's my birthday. We're going on that day to take care of this monitoring and getting taken care of. Okay, and here's my initials, and I am monitoring. All right, so there's my 2 rural areas that I'm monitoring. All right, now, what did I find? In 0400, I didn't have any deficiencies. I did not cite anything in the car. 0500, I cited 2 deficiencies. I cited diabetic training. Actually, hold on a minute. I want no deficiency here. All right, I want deficiencies up here. my highest level is going to be a type B. So when I went and I looked at the records, I had 3 staff in 0407 A7 who did not have criminal background screens. 3 of 3, and they didn't have any at all. And I had 3 of 3 who did not have healthcare personnel registry checked. So I cited 1 at a standard and 1 at a B. So my highest level is going to be type B. I did not cite anything in the resident rights. So those are empty. Here's the dates I'm delivering these cars to the facility. It took me a while because when I was taking care of Matthew's stuff and I didn't have time to get rid of mine too. So it took me to 11/09/24 to deliver it. I sent it 11/09/24 to ACLS, and now I'm gonna put my roll numbers. GO407A7-B, comma, GO407A6, and these rules, I'm just calling them off the top of my head, and I'm sure there's a couple of you that know these rules are wrong or right. I studied that as a standard deficiency. So there's my monitoring. Now, while I was also there, I had a complaint from a resident, and they were highly upset because the staff was opening their mail. So I have a new finding, and I'm citing that at General Statute 131D-2110. Now, note, if you're entering a general statute in, please include the general statute numbers and the parentheses and all of the actual punctuation, okay? So they're out there and they're like, she's opening my mail, I don't appreciate it. So, I'm citing that as a standard. Was resident right cited in the car? Yes, it was. I cited it at 131D-10. Which one did I cite? I'm going to pick the one. Right there it is. And I'm going to pick the level it was cited. I'm going to say standard. And I'm going to fill in these dates here. And I've already got my number over here, so I don't have to add it over here. Okay. Any questions? Right. Okay. All right. Thank you, Matthew. I appreciate that. All right. So what we're going to do now is we're going to move to our investigation log. Let's see what we got here. All right. Here is our investigation log. Flip over here. What you're going to see right off the bat is number one, that it is also color coded. It is color coded the same colors as the monitoring. So you know that purple is 1, green is 2, blue is 3, orange is 4. The information at the top is basically the same, except we did add the timeline here for your investigation period is July, August, and September, but we don't have the focused monitoring rules here because this is your investigation log. I want you to pay close attention here. This is very important. So if you are choosing unlicensed facility as your type of visit, you're going to enter General Statute 131D-2.3 as your rule number. And if you are conducting a death investigation, you're going to enter General Statute 131D-34.1 as your rule number. And I'm going to tell you why as we look at it, okay? All right, so this will be on each tab just to remind you what you would enter if you're doing those type of investigations. We just went ahead and put them on there so you wouldn't have to look them up. Again, we've got a giant note on here that you only are to enter 1 rule number per line, and we show you how to name your log on each quarter. So as you are saving this to your desktop each quarter or saving it to your folder each quarter, this tells you how to name it. Okay. So let's look at the one that's kind of our demo log. And again, this is for me, Matthew, and Bree. So this is for quarter 1. So we're kind of revisiting. We've already looked at our monitoring log. So we're looking at our investigation log for the same quarter. Now, note that we have 3 adult home specialists, so we technically could use 3 logs, but we're using 1. Okay, you have the option if you have 3 or more adult home specialists. Okay, now if you know if Bree is Bree's put her 2-week notice in, and we're just hiring Matthew just to replace her, and we know we're only going to continue with 2 on staff, you're going to continue with 2 logs. Okay, all right. So let's start investigations. So you're going to enter your facility name and the license number just as you have on the monitoring log and just as you have before. And I want to draw your attention to Matthew's example, which was very good. We had a family care home number 2, so we wanted to make sure that we're entering that name as it appears on the license. Of course, FCH, AL, ACH, those are approved abbreviations, but make sure you're entering it, you know, especially if you have clusters of homes, so you can make sure that we are all on the same page as we determine which facility it is. Even though we have the license number, we want it in the name too, so we're not all having to look up that license number. All right, so we get a complaint in at the county. So we're going to come over here and we're going to choose our type of visit. Please note you're going to have 4 reasons for your visits now. You're going to have a complaint investigation, a death investigation, an unlicensed facility investigation, or a new finding. Okay, and you're going to enter your lead adult home specialist initials just as you normally would. Again, you can enter more than 1. Now, when we get to this intake number, this is going to be any applicable intake numbers. So your county may not have an intake number. Maybe you don't use those. Maybe your county has its own system that they use to assign complaint investigations, and maybe that's this one. So I made this up, like New Hanover County 1074B. I just made that up. If the intake is coming from complaint intake unit, of course, it's going to begin with NCOO. So I'm just saying that any county does not have a system for which we name complaints. So I'm entering NA in there because my county just takes each complaint, we investigate it, it's not assigned a name. If your county did do that, you would enter whatever number you used. All right, the date the complaint was received directly to the DSS agency or complaint intake, or the date I opened it. So I got this complaint directly at my at my DSS agency to investigate on 7/3. Someone called it in on 7/3. Okay, so it was assigned to me. There's no number. Now I'm going to look at that complaint. I'm going to staff it, and I'm going to initiate that complaint based on the guidelines in General Statute 131D-26, which provides the mandates for initiation of complaints. So after I looked at that, I went out and I initiated it on 7/6. And again, note my 6-digit date. The date I completed that investigation. That's the date that you have wrapped up your investigation. You've completed everything. And so 07/23/24. The date that I'm exiting with the facility, it may be the same date, it may be a different date. Case in point, you've completed your investigation and there's a car to follow. So you complete your investigation on 7/23 and you know you're going back to write that car and it's an A1. But before you exit with the facility, you know you have to have that report read by quick. So you don't exit with the facility until you write the car, it's read by quick, then you exit with the facility. Okay, so if you're coming to a situation where you're submitting stuff to quick, this is when your dates are going to be different with your completion and your exit date. All right, and again, these are all filled in based on when you exited. So if I got this complaint in July and I did not complete it until October 1st, I would have to put it on quarter 2 because I completed it outside of September. All right, so my rural area was F0902B. A resident called in and said they didn't take me to my doctor appointment. I missed it. I missed my podiatry appointment. and, my feet are hurting. So I go out there and this is the only rule number. So it's F0902B. That is the rule number that I opened it based on the complaint. The resident said, I didn't get to my appointment. I was supposed to be there. They were supposed to transport me. I missed my appointment and they haven't followed up with the doctor. So I go out there, I pull my sample relevant to that 902B, and I substantiate this finding. And my choices are refer to SOD, substantiated or unsubstantiated. So you have 3 choices only. Hint, hint, hint. The only time you choose refer to SOD is when the complaint intake was taken over by ACLS and the finding is incorporated into an ACLS survey. And we will talk about that. So I'm completing this, so I'm substantiating it. I'm going to come over here and I'm going to choose what level. There we go. I'm citing it as standard. Again, I'm going to answer these questions in the orange related to the resident rights exactly as I would for the monitoring log. I did not cite resident rights. I don't enter anything there. I don't enter anything there. I'm going to get over here to column Q. I'm not going to touch this column no matter what's in it. I'm going to skip it all the time. It says do not enter. So I'm just going to tab right on over to the next column and forget it. And now I'm going to enter the date that I delivered that documentation to the facility and the date I delivered that documentation to ACLS. I'm at the green, boom, I'm done. All right, good. Now we get another complaint investigation in, and Bree is going to look at this one. And as we can see, it is at Star Care and it is NCOO 11444. So that means that it came from complaint intake unit. And if we look at it, we're going to see that it's listed on multiple lines. Why is it listed on multiple lines? Because it has multiple rule areas. Okay, so we're going to look at that. So let's take a look at how we're going to determine what goes on these lines. So let's. All right. Okay, so here's my complaint intake that Bree got. It says reference F0901. And it says resident has dementia. She's blind. She's had a fall. She's found on the floor. It says subcategory provides supervision to the resident. So I see 0901 there. Based on reading this intake and what this says here, I know that's supervision. So that is 0901B. If I'm not sure what it is, I'm going to have to pull my rule book and I'm going to have to pull 901 and I'm going to have to see what it marries up to. I want to bring to your attention that when complaint intake unit sends you complaints, they will always reference a general statute. Okay, that does not have to be entered on your investigation log. They will automatically reference a general statute that is related to the actual complaint. So in this particular instance, the reason they entered that resident rights statute number 2 is because it falls under care and services. That is their process. But you are looking at, for this particular allegation, F0901, and it clearly says provide supervision to the residents, and it's talking about falling. So we are going to say, okay, I'm going to enter F0901B on my log. Now I'm coming down to the second one. It's got a second rule number on there, F1201. I see this general statute number again. I'm not really worried about that. It tells me that the records are not orderly. Okay, so when I pull up 1201 in my record, in my rule book, I can tell you it says it shall provide orderly records, and it'll say A, FL2, B, MR2, C, resident orders, D, medication orders. So in my mind, I'm going to have to look at this whole rule. So I'm probably going to enter F1201 because I have to look at the entire record. I've got a general rule here listed, but based on the complaint intake and the information in it, I cannot determine if it's going to be in a specific subsection of that rule like I can for this 901. So I've got 901B and I've got 1201. All right, now I've got one more complaint on this one. One more find the final one. And I really appreciate y'all's patience as I navigate through these, but I want to show these so we can look at them. I can't find it. Here we go. All right, and my final rule area is reference 1004A. The resident was diagnosed with dementia approximately 3 weeks ago. They got their medicines late, got them too early. The 7 a.m. medicines were given at 11. So here we go. We've got problems with medication administration. So it clearly says 1004A here, but I mean 1004. When I look at my rule and I read the allegations, we can see that that is 1004A, administer medications as ordered. So let's go back now and enter these areas onto our complaint log based on what we've just looked at. So come back to this little log here. All right. Let me move my cursor back up. So we're over here. Here's our complaint. Oh, sorry, y'all. I didn't mean to do that. So here's our first rule number, 0901B, which we saw supervision. Here's our second rule number, F1201, which is resident records. And here's our third rule number, F1004A. Notice that all are on a separate line. There are no punctuation used, no decimal points used for rule numbers. Those are only used for general statute. So there they are. Okay, I've entered my rule numbers. Now I'm going to enter the additional information for each one of these lines. Okay, and when you're entering the information, I want you to take note at the options that are going to be available to you. So F0901B, Bree has substantiated that. So when she comes over to choose her choices, she has 3 choices: refer to SOD, substantiated, or unsubstantiated. So she's choosing substantiated, and that's going to make her choose a level of severity that was cited in the car for 0901B. So she cited it at A2. Her next rule area was F1201. She did not substantiate that rule. So she comes to her drop-down box, unsubstantiated. When she comes over here, it was unsubstantiated, so there is no level of severity. So she leaves it blank. Okay. Now we come back over here, F1004A. She chooses the choice here. She substantiated it and she put her level here. Again, we are choosing if we cited any resident rights in the car. If we did not, we choose no. And if we choose no, we leave the other 2 orange columns blank. We are now to our yellow column, which we do not touch or alter. There it is. We leave it alone. Then we come over here, we enter the dates that we are delivering the documentation to the facility. We're using a 6-digit date, and it is going to automatically format it to a different. So there's my date. And when I hit enter, it's going to take it to where it wants it to be. Okay. So I'm entering 08-29-24, and it changes it to that, and that's okay. Leave it like it is, but just wanted to bring that to your attention. If I have any additional notes about this intake, I can type it in here. If I don't have to. So there's that. So I've entered all those. All right. So now we have looked at that complaint. However, while Bree was out there, I'll go back over here to my left. And remember, use your little tab here at the bottom to move you along. All right. So we have another complaint at Margot's Family Care Home. Tamara is investigating that one. Here is my intake number, which came directly from complaint intake. When I look at it, I see that there is no specific rule area listed. There is no specific allegation, and it's a self-reported death entity from a facility. So I'm going to choose as my type of visit, if I can get it over there, death investigation. I'm entering my information here. I'm going to enter the General Statute 131D-34.1 because it is a complaint investigation. So that's what you will enter. Anytime you choose death investigation, you will always choose this general statute here in purple. I'm going to enter that in. And the reason you enter that in is because the law says that it has to be investigated in accordance with this law. And so you are looking at all rules in relation to that death investigation. You're doing a more generalized probe to determine if there is non-compliance in any rule area, because there is no specific allegation or specific rule area. So that's why you enter 34.1 here. Then you're going to document your outcome. So if you substantiated anything in relation to that death investigation, you will choose substantiated. If you did not substantiate anything, you will choose unsubstantiated. And if you, of course, have that complaint taken over by ACLS, then that's when you will choose refer to SOD. So after you choose the outcome here, you will come to the level of severity and you will choose the highest level of noncompliance cited in the CAR. So if you cite one rule area, you're going to choose the level of noncompliance that was cited. If you cite two rule areas, one was a B and one was an A1, then you're going to choose the highest level, which is an A1. Then you're going to come here and you're going to determine, hey, was resident right cited? No, it wasn't. You're coming on along. Again, you're not touching that column. You're entering your dates here. And when you get to your green column, you're typing in the exact rule areas that were substantiated and cited in the CAR and the rule numbers. So I have substantiated this death investigation and I have written a CAR with noncompliance in F0901B at an A1, which is supervision. And then I have also cited in that same CAR a A2 at F0902B healthcare. Okay, again, if you just cite one rule area, that goes there. If you cited 5 rules areas, they would all go there with the level. Okay, so that's how you do a death investigation. Now let's look at a complaint investigation that is taken over by the state. So we get a complaint investigation at the best assisted living. Here I go. It's a complaint. There's my intake number. I've entered, my days there. All right. I want to bring your attention. So the rule area was 0901A. But they called me and they said, hey, Tamara, we're doing a annual survey over here at the best. Would you like to come? And do you have any open complaints? Oh yeah, I've got an open complaint. I just opened it, but I'll come on the survey with you. So you go on the survey, and while you're on the survey team cites 901A personal care at an A1, and they find non-compliance with 7 residents at an A1, and they're citing it. This is just terrible. Okay. What are you going to do? You're going to come right over here. Date DSS completed the investigation. You didn't complete it. So you're going to hit NA because you did not complete it. Date completed, DSS completed exit conference with facility. Now you can put a date here if you do that. If you don't, you would put NA. But what I would suggest is, and I think this is how most counties do it, is once that complaint is taken over by ACLS, then the adult home specialist goes and says, I initiated this complaint back on 7/6. It was incorporated into the ACLS survey. And so I'm letting you know that the findings are included in that, and if you do that, then that's where you put the date there. If you don't do that, then that's NA. Again, here's just the only rule number, but your outcome is refer to SOD. Okay. And when you refer to SOD, there's not going to be any outcome for you to choose from, because that is going to be calculated and determined in our SOD. So you don't need to put anything here. We don't need you to take time to enter what levels was cited by ACLS. We have that information. So if it's taken over by the state, you choose refer to SOD. You don't have an option to choose level of severity. You do have to answer this resident rights question every time because the law says that we have to know how many times it was cited. You're always going to hit no when it's refer to SOD because it asks you specifically, was it cited in the car? So you're answering if it was cited in a car. If you didn't cite a car, then you're going to choose no. Perhaps they cited resident rights in the SOD, but you're going to choose no because it says, was it cited in the car? Okay, it doesn't matter if it was cited in the SOD. You're answering if it was cited in the car. If you choose no, you're going to continue on with your blanks. Okay, because you entered NA over here and this was taken over by the state, you're going to have some odd error messages and numbers and values. You don't touch this, so you just tab on along and you go to the next one. The date the documentation was delivered to the facility is going to be refer to SOD. Okay. If you go in and you deliver them a 4610 or whatever that number is, and you give them and it says, this complaint intake was taken over by ACLS and it's in the SOD, then you could put that date there. And then the date the documentation was sent to the ACLS email group. So this is where you are sending your CIS in that says, refer to SOD. And that's the date you sent it in. Okay, and then you can put your notes here, CI taken over by state when AHS assisting with annual survey. You don't have to do that, but you can. Okay, so if this complaint is in 0901A and that's the only rule number, let's say there were 50, okay, you still have to enter 50 rule numbers separate, even if it's refer to SOD, because we have to know each complaint rule number that was investigated and was referred to the SOD for findings. We still have to have that data. Okay, so you still have to enter each rule number on a separate line, even when it's referred to the SOD. Okay. All right, let's choose one where we are doing an unlicensed facility. So you are in talks with the ACLS team supervisor or branch manager. They call out and they say, hey, we heard that there's a boarding home running, or maybe it comes into you and, we've got people calling in from the county and they say, we've got a boarding home. And so you talk with ACLS regulatory team. Usually it's the regional team supervisor, and sometimes it's elevated to the branch manager. The branch manager provides you with details on how to conduct that investigation. They tell you to complete that report to record form. And then because it was an unlicensed investigation, you want to log that on this log. So if you know the name of the facility, you can type it in here, Billy Bob's. If you don't, then I may put 114 Main Street, anywhere. Okay, you can put the address. License number, there's not going to be a license number because it's not licensed. The census, if you can get the census when you're there, go ahead and get it. If they won't let you in the door, then you're going to have to leave it blank. Put your initials. They're going to ask you for the intake number. Again, if you opened it at your county and you have an intake number, put it in there. If, you don't, you put NA. All right, so here we go. Date complaint received directly at DSS agency or from complaint intake, or it was opened by DSS. So let's say you get a call from the branch manager and they say, we need to have a meeting. We have an unlicensed facility. We need your assistance investigating. So when you have that meeting and you get the details of that, that is the date that you received it. If it gets called into your DSS agency, that is the date you received it. Okay, that's what you are entering here. The date that you were actually first on site to initiate it goes here. The date you complete it goes here, and then the date you completed the exit conference goes here. Perhaps you get to the facility and they say, you're not coming in, you're not coming in. Forget it. You're not coming in. So NA, date exit conference, NA. Now they're going to ask you for the rule numbers. You're not going to enter any rule number except general statute. Now we're out there looking to see if they're getting care and services, okay? But because this is an unlicensed facility, we're always going to document the general statute 131D-2.3. as our rule number. Okay. When you have an unlicensed facility, the first thing you're going to see, move this up a little bit, you're not going to have an option for your outcome except NA. And the reason you cannot substantiate or unsubstantiate is because they're not regulated by laws. So the answer is going to be NA. So you're going to put NA there. Here we go. When you choose NA, you're not going to have any level of severity because they are not licensed. They cannot be regulated. We cannot cite them at any level of severity. Okay. Then you're going to go to this next column, and you always have to fill this one in no matter what. So just remember, this orange section has to be filled in. And if you choose no, you only have to choose that one. If you choose yes, you have to fill the other columns in. Again, you're going to come to your yellow column here. You're just going to always tab over that. If you have documentation that you delivered to the facility, you'll enter that date. If you did not and they wouldn't let you in, you can hit NA. The date the documentation was sent to ACLS is the day you send in that report to record or whatever documentation you were requested to submit. So you would enter that here as your 6-digit date. And then if you want to add additional details here, maybe perhaps you put the, the address here. Maybe you knew the name over here and you put the address here or something like that. But it's not required. It's only if you choose to for that particular type of visit. Okay, so we have gone over each of our type of visits. I want to go over new finding. We saved that one to the end because we had a question. So when we were talking about that complaint investigation earlier where she substantiated it, want to show you that while she was out there conducting that complaint investigation, something else was also drawn to her attention. Bree is a registered dietitian, and so while she was out there, she had some complaints and concerns about the nutrition and food service rural areas. She did investigate it. She gathered observations, interviews, and record reviews, and she determined that there was deficient practice at standard deficiency level. So what did she do? She came in, she entered a new line, and the reason for her visit is not complaint investigation, because she was already on the complaint investigation. The reason for this rural area being entered is because it is a new finding. It is outside of the rural areas that were in the original complaint. So when we read that original complaint, we did not see the 0904 rural areas listed. And because that was not on the original complaint, we have to log it on the line as a new finding. So she logs that, she substantiated it. I mean, she chose the outcome as standard deficiency. And then because she's already chosen her outcome here, her level of severity does not have to be entered. So just note, you're going to fill in the choices that are applicable, which we really worked hard to make sure that when we had extraneous information where you did not have to fill in information, that it was just not an option. So you could just kind of skip over. Okay, so that's your kind of your new findings. Okay. All right. So I want to take just a couple questions. We're running a little bit short on time, so I want to take a couple questions if we have them on this monitoring log, and then I want to turn it over to one of my DSS partners to help me kind of log a investigation visit too. So let's take our questions if we have any.
Okay, we do have 2 questions here. I think we've answered one. One is, I know this goes into effect 7/1, but what about our currently open complaints? Do we put it on our current log, then repeat it on the new log as well, since it will be exited in July?
Okay, so if you are exiting after July 1, it's going to go on the new log. So
And
did
the
I
other,
answer that question? And I want to make sure I'm answering and I know sometimes it sounds like I'm being very cut and dry, but I'm thinking in process. And so if you open an investigation on July, let's say you get a complaint investigation in and you get it in on June the 30th. Okay, so that falls into this fiscal year, does it not? Because it's June 30. But you open it, you do not get out there to open that investigation until July the 5th. Okay, and you're going to exit within 60 days. So that's going to still be in that July, August, and September timeline. So it will go on the first quarter of this new fiscal year log. If you are currently working on an investigation that was opened in fourth quarter and it will be completed by June 30th, 2024, it goes on your previous log, the one that you're using now that is not color coded. So if it is closed on or before June 30, 2024, it goes on the previous log. If it is closed/exit date July 1 or greater, it goes on the new logs. That is for monitoring and complaint. Did that answer the question? Hopefully.
Okay.
Okay, perfect.
That's yours. And the final question here is, if we have no jurisdiction over unlicensed facilities, then, hold on, I'm sorry. Another one's coming in. If we have no jurisdiction over unlicensed facilities, why is this an option?
Because we are to track, the law mandates that we track all visits made to facilities. And as our partner, we are required to investigate unlicensed facilities. So that's how we are tracking them. And that's how the adult care licensure section oversees the tracking of these unlicensed investigations. And I know that these unlicensed facilities are hot topics. I don't want to go down that trail of the unlicensed facilities. I want to stay on how we enter these into these logs, but I hope that I answered the question on why we have to put it on the log. So I think I did address that question,
Okay.
hopefully. Okay.
All right. And I think we have one more since we have
Okay.
limited time. I would like to confirm that it is okay to enter a local case number if your county uses a local.
Absolutely. So what's your local case number? Type it in the chat. Just give me one.
056893.
056893. Okay. Oh, that's weird. Hold on, that's odd. Hold on. Okay, we might have to look at this. Look at that. It's not taking it. Check that. I'm so glad we looked at that. So we have to look at that. Date, column F. And we have played with these. I mean, you would not believe, I've got one that's got about 80 lines on it. So I'm not sure why that's doing that. Maybe you know what? I think I'm going to have to choose my type of visit first. Hold on a second. Let me see. Nope, that ain't doing it. All right, I'll have to check that. Thank you. So somebody take a note.
All right.
And that's why we're kind of doing these demos live. Okay, so I want to move to our other part of the demo because we're running to about 10 after. So I would like, if I could, to have Miss Regina Anderson from New Hanover County to please unmute your microphone.
I have to go in. I'm sorry, Tammy.
Okay.
I'm gonna have to go in and unmute her. While I'm looking for her, there was one is if you could elaborate or just clarify when the adult home specialists share a log. Like if they're partnering. And
if you have one or two adult home specialists that are your primary adult home specialist at your county, you share a log. If you have 3 or more adult home specialists in your county who are the primary adult home specialists, we're not talking about backup. So if you have 3 or more primary adult home specialists, you have the option to separate the logs. If you have 1 or 2, you use 1 log. And that would be 1 complaint log and 1 investigation log.
Okay, thank you. And Regina, you should be able to unmute.
So Regina is an adult home specialist from New Hanover County. And again, I called her cold this morning and told her to kind of provide me with a complaint scenario. So Regina, take it away. Let's see what we can do here. We're going to go with quarter 2, if you don't mind.
Let's see. Quarter 2. Received a complaint investigation related to falls. So I initiated it related to personal care and supervision.
Okay, so let me come over here and I'm gonna say F0901B. Is this in an adult care home or family care home? I guess I should ask because I need to put the G or F there.
Adult care home.
Okay, gotcha. Okay, what's the name of it?
Spring Arbor of Wilmington.
Okay, and I'm gonna put a fake name here. Okay.
Okay.
Okay, and I'm gonna put up here, my county is any. My names. And now I've got a new supervisor, and that's Nikki Lee. So I'm adding Nikki here because my new supervisor is Nikki. Okay, and of course you're entering full names. All right. And then we would enter the license number. Let's just say it's HAL 9900000-223. All right. What was your facility census when you got there on your first visit, Regina?
49.
49, okie dokie. And so we've got type of visit. So we are going to choose complaint investigation. And Regina is doing this. So this is Regina Anderson. Now, was this received at your agency or did it come in from us? Complaint intake.
Our county intake.
All right. What's your county intake number?
29663.
See, it took it there. I don't know. Okay. Who knows? We'll figure it out. All right. What date did you receive it?
This was received on, let's just say 10/7.
All righty. And what day did you initiate it?
10/8.
All right. Now, oh, did that wrong. So the date that you actually completed the investigation, which means you wrapped your investigation up, maybe it was the same date you exited with the facility, maybe it was not, but when did you complete your investigation?
11:30.
Okay. And the date you completed your exit with the facility?
Was the same date.
Gotcha. Righty. And so we know the rule number. And what was your outcome?
That resulted in a type A2.
All right, so that's substantiated. And now I have to come over here and I have to choose my level of severity, which is A2. Now, did you cite resident rights in the car when you cited the A2?
Yeah.
Okay. And so we're not going to enter anything in those two. We're going to get to this box and skip it. And the date you delivered that car to the facility?
Let's just say, that's the date, 12/10.
And how about the ACLS?
Same date, send it to them.
Now, do you have anything that you want to add related to that, or did you have additional findings, like a new finding that we need to add to a new line, anything like that?
Yes, I had 2 additional findings.
Okay, perfect. So here we go. It was finding all kinds of stuff. All right, because this is an additional finding, it's going to be called new finding because it was in a rural area other than F0901B that she originally opened the complaint in. So RA 29663. All right, we got 10/7 because that's the same. Uh-oh. All right, what do we cite?
1212A, reporting of accidents, incident reports.
Okay, and what did we cite it at?
A standard.
Okay, and because this is new and we put our outcome here, we don't have to key in anything here. There's no option. Did you cite resident rights in the car?
Yeah.
Okay. All right, all this dates are going to be the same. So now we're going to come back and enter her third finding. And I'm going to leave these blank and just come on over here to the rule number. What you got for your rule number, Regina?
1307, 1, special care unit profile and care plan.
Okay. Oh, it's like special care unit 13071A. Is that what it was? Like your care plan?
Mhm.
Gotcha. All right. What did you cite it as?
Standard.
Okay. So I've got my rule number there. Notice we don't have any other punctuation, and we cited that as a standard. Again, we've already got our outcome here. Did you cite resident rights? We've already said no. Come over here. Okay. So there we go. So there it is. So anything else we need to add about this, Regina?
All those dates are the same.
Okay.
And sometimes, like in that green, I would just put follow-up will be done at a later date.
Yep. True. You can do that. Yep. All right, so that's good. All right, thanks, Regina. So now that we've got that, I want to show you what we're going to do. We're going to follow up right now to Regina's complaint. And we're going to follow up. We did this in Q2, October, November, December. We had that A2, so, and we ended up exiting on 11/20. So if we have an exit date of 11/20, we have a correction date 30 days from that, which would be around 12/20. And then, of course, after that correction date, we need to allow a sufficient time to pass. So then when we go back to do our follow-up, we are able to pull a sample to be able to look to see if there is compliance in those rural areas now. So we're probably not doing our follow-up until we're getting into late part of January. So what we're going to do now is we're going to go and we're going to do our follow-up for this right here. And we're going to do it. We're going to go to our monitoring log, because this is where we put findings. We're going to go to Q3 because we're following up in January, February, and March, and we were going to be exiting in January, February, and March. So we're going to put Spring Arbor of, I think I put Jones County. We're going to put the same license number, HAL-O. I don't know what it was, but I want to make sure we have time to cover this. 001. All right, here's the facility census 65. All right, we're going to document every day that we're over there doing this. So we are doing a car follow-up. We're going to enter every rural area that was cited in the car that we're following up on a separate line. So we cited F0901B. We cited F1212, I think it was A, and we cited F1309A1. And we're going to say car follow-up, and of course, this is all the same. Okay, and the dates that were on there. So let's say we went and we initiated it, the follow-up of 1/27/25. We didn't get done. We had to go back, so we went back on 02, 03, 025, and 02-0425. So we went back those 3 days. Regina's doing it. And again, she's entering this information on every line. Should we choose that? And you have to choose your type of visit here before you're going to be able to enter these. So here we go. She's got her car follow-up. Let's choose what ended up happening here. Level of severity. Did you recite this, Regina?
It was a beta.
It was abated. Okay. How about your 1212A? Was that abated or was that recited?
They were corrected.
Okay, so we're gonna call that abated. We just put abated instead of adding that correction abated. Okay, so you can use abated for, and then how about 1309? How about that one?
Abated.
Okay, perfect. All right, and so if they're all abated and we're not citing anything, then the answer is gonna be no here. And again, you're using the same process for entering this resident rights data on your complaint log as you are on your monitoring log. And you're going to have to answer that first question because the way the law is written, we have to calculate the number of resident rights cited and the level. So that's why we ask you to answer that on every line. And then so she's going to deliver so if she went back on 2.5, let's say she exited on 2.5 with them. So she's going to go ahead and put it right here. And she's going to come back into the office and she's going to email it right on back to ACLS. And there you go. And she don't have to write that on all line, but again, she's putting that for each line. Let's say when she was out there doing her car follow-up, somebody came up and complained and said, wait just a minute. What did they say? The telephone. I don't have a telephone to use in private. So she looked at it. That was a new finding and she ended up citing it. Let's say she cited it and let's say she looked at F0909 because that's resident rights. She ended up citing it at a standard deficiency. But she did. So when she read about it, she said, well, you know, I think I'm just going to cite it as the resident right. I opened it in 909, but I'm going to cite it in that resident rights rule area. So she cited it in the resident rights rule area and she's going to pick the one. And I can't remember which one it is. I don't remember. Or maybe it was something about resident privacy. I know resident privacy is number 1. So something about privacy. Number 9. I knew you would know it. I should have asked you. This woman knows every rule. She can recite it like a book. So there you go. So there's that. So she cited it. And of course, again, she cited it as a standard and she's going to fill this in and go right across. Okay. So that's how you would do a new finding if you were doing a follow-up. We already went over how you would do a new finding if you were doing monitoring. Okay. So we are running very short on time. So I'm going to ask Regina to mute herself and I'm going to come back. I'm going to stop sharing my screen and I want to bring this, stop sharing my face because I'm sure you don't want to see that. I'm going to try to bring this PowerPoint back up and I want you to know what did not change. So what did not change is our standard monitoring investigation protocols. So that's not changed. Okay. The rule areas that we monitor are not changed. So, you know, that's not changed. It's on your log. So just don't get worried and confused about that. But I do want to show there is a couple of key changes we need to go over. All right. So we've already looked at our demos. All right. So this is just, this slide deck is just going to show you some key reminders that we went over. I'm going to skip through these because I want to get to a couple of changes that we need to go over. So one other thing I want to bring to your attention is the way that we've set these logs up is you just need to submit your logs quarterly. You don't need to continually resubmit them as they are updated with an investigation outcome. Why is that? That is because now we don't have the open and pending finding. You are logging these visits based on their exit date. And so if you have something that is updated after you've submitted your log, it will be captured on the next quarterly log submission because you're using the same log. The only time that you would need to send in a revised log outside of the quarterly monitoring time frame would be if there is an error identified by either yourself or the adult care licensure section that requires correction. If that is necessary, then you would send it in and you would note that it was corrected. And please note that if you are being asked to correct a log by anyone in the adult care licensure section, whether it be the regional team supervisor, training specialist, branch manager, or county liaison, that we ask that you make that correction and resubmit it within 3 business days. All right, I want to bring to your attention an important clarification that we want to make sure everyone is on the same page with, and we're going to start really looking at this effective July 1. So as we know, when we pull up General Statute 131D-26, it says that complaint investigations must be initiated within specified guidelines, and it states that investigations must be completed within 60 days. So because that statute is a tad bit ambiguous, it just says 60 days. So we get questions, is that 60 calendar days? Is that 60 business days? Is that 60 days of receipt? Is that 60 days of initiation? Well, your answer is, it is 60 days of receipt. So does not matter what you have been trained or what you have previously done. When you receive a complaint, you have 60 calendar days from the date received or opened by your agency to complete the investigation. Here's why. The way that the initiation states, it states you have up to 14 days to initiate. So we have some counties, some do, some don't, some counties who count from the initiation date, and they say, well, I got the complaint on July 1. I initiated it within 2 weeks, which was July 15. I have 60 days from July 15 to complete that investigation. They completed on day 60. And what that means is that complaint investigation is now 75 days old, which exceeds 60 days mandated by law. So you would have 60 days from the date that you received it, which would be 7/1 to complete it. So you would have 7/1, 60 days from that date to complete it, to be in compliance. Okay. Just want to make sure everybody's on that same page. It is now in the revised adult care licensure section standards of operation. The other thing, so here is one. So if you received this complaint to your county and you received it on 1/14 from complaint intake, you would have 60 days from 1/14 to complete it. All right, let's talk very briefly about death investigations. Now, we were not on the same page with death investigations, and when you read 131D-34.1, what you will see is it gives you general guidelines. So effective July 1, 2024, the adult care licensure section has updated the standards of operation for initiation and completion of death investigations. And so effective that date, this is now the process, and this is a change. I will say in the past, this was a guideline, but it was not a SOP. So the change is now it is written into our SOP. So you must initiate a death investigation as soon as possible, but not with to exceed 14 calendar days of receipt. And you must complete the investigation as soon as possible, but within 60 calendar days of receipt. There are some very specific information in the 2 SOPs that I just went over, and those have been posted to our ACLS SharePoint site. I put a couple reminders in here for your complaint investigations and your death investigations, including your timelines, just for your reference. Here is an example of a death investigation. It came to the county on 5/9/24. It was also referred to disability rights on 5/9/24. Your DSS agency has 60 days from 5/9/2024 to complete it, and your DSS agency has 14 days from 5/9/2024 to initiate that investigation. Anytime you have a serious allegation for which you believe there is serious outcome to residents, of course, you want to make sure that you are initiating those more timely. The other thing I want to draw to your attention is the change that's going to become effective related to quarterly oversight. So after July 1, after you start turning in your logs for next fiscal year, you will receive an email from the ACLS team reporting if your requirements were met or not met. So you will be told if your county met the requirements for monitoring, if your requirements were not met for monitoring, you will be told if your requirements were met or not met for complaint investigations, and you will be told if your requirements were met or not met for submission of documentation. All of that information is in this training, and it's in this PowerPoint. Again, all of these SOPs are on the SharePoint site. I'm going to stop sharing just so I can show you where the SharePoint site is, and I think we're at 31, but I want to show you that site and then we will leave. See if I can find it. Trying here to find it. Here we go. All right, so here is the county DSS site. When you come to it, here is your home page. Want you to know that we usually put the most up-to-date trainings here. I will post this here in this section, but I do want to draw your attention to this top ribbon, quarterly monitoring. If you will come here to this tab, it's going to have the information you're going to need for monitoring, including the most up-to-date SOP. I have not posted the new logs on there yet, but I will post them on there. The monitoring log will be here as well as the instructions. So those will be there, and I will post them this afternoon. Complaint investigations, here is your tab for complaint investigations. Here is the general statute. Here is the standard operating procedure. We have the new SOP here. So for instance, if you went to pull that now, it's going to be there online. You're going to be able to see it. We're hoping it should come up. Let's see if I can get it to come up. Might be that I've had my SharePoint signed on too long. No, there it is. So there's your new SOP. You'll see that effective date 7/1/2024. So there is that one. And then if you are looking to see additional resources related to to death investigations, if you will click on your three dots and go down to death reporting and investigations, there is also a tab for that. And again, we have our SOP here for death investigations. We have the training, we have your forms. All of that information is here. Okay. So with that being said, I see that we have run over a little bit. I do want to thank my generous DSS partners who were called cold this morning and were game to help me. I want to thank the ACLS branch managers as well as supervisors as well as section chief for all of their efforts in assisting with getting this project out and rolling. I want to thank the trainers. They have been very helpful as we write these instructions. I want to thank Joan Towie, who has helped us get these logs together. And I want to thank you all for your participation, your engagement. We do have changes, but we really believe that these changes are going to be good for the good for everyone. It's going to be easier to fill out these logs. The communication process is going to be much easier. So if you have questions, please pull the directions as you are completing your logs. Look at those directions, look at this training, use your resources and try to kind of troubleshoot there. If you have additional questions, of course, we will be glad to address those. And then once we start getting in the quarterly logs for next fiscal year, which is going to be at the end of that first quarter. So that's going to be, let's see, July, August, September. It's going to be around October 15th. When you start submitting these new logs with these color codes, we are going to be kind of on the lookout to see if we're seeing any errors that need to be immediately corrected. And so the trainers and myself, as well as your ACLS team supervisor, will let you know if there is something that needs to be immediately corrected. Again, you want to save the log that you are using and use it for the same fiscal year. Somebody said it really, really easy for me, and I thought about it and I thought, yeah, that makes sense. So you're using this log and you're just saving it over and renaming it each time and turning it in. That's somebody said, so essentially I'm just renaming it and sending it in. I've just got, and I said, yes, you're adding something to quarter one. The next time you're adding to quarter two. So you're just sending in the same log each time. And again, if you don't use that same log, you're going to kind of be given your old log and said you've got to move it to that previous log, because if it's not on there, we're not going to be able to complete that oversight process. So if you would, go ahead and submit any additional questions you have to the DHSR training email group, and they will be addressed. Thank you so much. And I'm sorry that we went 6 minutes over, but I think we did a good job with that demo. And I really am glad we got to do that part of it. So thank you all. Hope everyone has a great day.